Welcome, everybody, to the beginning of the first annual California Ballot Measure Convention, also known as BallotCon. My name is Dan Schnur. I serve as the director of the Jess Unruh Institute of Politics at the University of Southern California. And I also have the great privilege of serving as a board member for C Political, the organization that is taking a lead in organizing today's conversations. And before we go any further, I want to give a shout out to the entire team at C Politico, the volunteers, the interns, my fellow board members who do much more work on the board than I do, and most specifically, our founder and our leader, Nate Kaplan, for all the time and effort he's put in, not just to organize today's conversation, but everything we do as an organization to provide necessary information to California voters about ballot initiatives in this election and others as well. So before we get started, let's give Nate and the entire C Political team a round of applause. And Nate, I promise you by the end of the day today, the applause will be much louder and much more fervent, but it's still early on a Saturday morning, so that's the best we can do, okay? Okay. So over the course of the day, we're gonna have conversations, debates, but civil and respectful debates, about the entire range of ballot measures that Californians will be voting on their statewide ballot in just a couple of weeks. And I've got the great privilege of moderating the very first of those conversations. And today we're going to begin the conversation by talking about Proposition 56, the proposed tobacco tax. And I'm really fortunate, and frankly, you're all very, very fortunate as well, that we've got two of the most respected public policy experts in California here today, both of whom, it's our good fortune, are involved in the Prop 56 campaign, one on the yes side, one on the no side, and they're going to be leading us in today's discussion. Arguing the yes side in favor of Proposition 66 is Shannon Murphy. Shannon, thank you so much for being here with us today. You guys can clap for her too if you like. And the rule we'll set for the day is if someone's introduced, even if you're on the other side of the ballot initiative, let's clap for them too, just to give them a false sense of comfort, okay? Okay. And so with that in mind, no false comfort intended, David, because we know we've got a lot of people who agree with you on this as well. On the no side is David Wolf, who's the legislative director for the Howard Jarvis Taxpayers Association. David, we're very, very happy to have you with us as well.
Thanks, Dan. Yeah.
So the way these debates are going to work over the course of the day is we're going to ask each side to make an opening statement. Then the moderators, myself and a range of others over the course of the next several hours, will ask questions of both the proponents and opponents of each of the ballot measures. And then what we'll do as frequently as we can is try to work in as many questions as possible. From audience members, if I'm not mistaken, you've been given the opportunity to write down questions, which will be given to us, perhaps not for every initiative, but for several over the course of the day, because we want to make sure there are as many voices in this conversation as possible. But we're going to begin with opening statements, and so we're going to start, appropriately enough, with the yes side, those in favor of an increase in California's tobacco tax. And so we're going to start with a 1-minute opening statement from Shannon Murphy. Shannon, the floor is yours.
Thank you for being here. I'm joining with the American Academy of Pediatrics, the American Heart Association, the American Lung Association, the American Cancer Association, State Schools of Superintendent, and many, many leaders to urge everybody to get out and vote in support of Proposition 56. What we're proposing is a $2 tax per pack of cigarettes. This would be a user fee, and we know that this is crucial because in many, many states where tobacco taxes have increased, we have seen a decrease in smoking. Currently, tobacco, and make no mistake about it, tobacco is funding the opposition to this initiative to the tune of over $70 million. So big tobacco is targeting and preying on our youth. More than 17,000 teens get addicted to smoking every year. More than 40,000 Californians die each year. This is a health crisis and it's an epidemic, and we would like to address it.
Shannon Murphy, thank you very much. A 1-minute opening statement also from David.
Yeah, Dan, thank you very much, and good morning to everybody out there in the audience. HGATA is part of a broad coalition in opposition to Proposition 56. I do work for the Howard Jarvis Taxpayers Association. And just 3 points. I mean, the main point with this is just ensuring that taxpayers understand important tax issues coming before them and facing them on the ballot. And regardless of your thoughts on tobacco and how much it should be taxed, the way this tax is structured is fundamentally flawed. This is a very regressive tax. We're doubling the tax on tobacco users in California. Only 12% of Californians actually smoke. It's the second lowest rate in the country. And that's one of the points. We're taxing a declining revenue source in a way that doesn't make a lot of sense. Also, just the regressivity of it. Half of the individuals that do smoke are at or below the poverty line in the state of California. And so, I mean, I think, again, there's just fundamental issues with how this tax is structured. And we'll touch on that, I'm sure.
Absolutely. So the first question I'm going to put to each of our guests, and I'm going to preface it with a reminder, not just for these two, but for everyone who joins us over the course of the day, is that I think how much we all want to be able to have these conversations in a civil and respectful way. And I think it's a great reminder, and Nate and his colleagues deserve a lot of credit for it, that we can get together and debate legitimate policy differences without engaging in invective or throwing things. Have we got that, guys? No? Yeah. Okay, Jessica. So the first question I'm going to ask you, and I'll go to you, Shannon, first, is what's wrong with what David just said?
Well, there's a couple things. So the idea that this is a tax that's targeting lower income and minorities, the reality is tobacco is targeting lower income and minorities. Again, we have 14,000 teens getting addicted every year to smoking tobacco. It's unacceptable. There's 1 in 6 deaths in California are a result from tobacco. And so that's more than people getting killed by handguns, people that die from doing drugs, from drinking alcohol, from HIV and AIDS combined, and car accidents. So what we need to do is to put measures in place that would be a deterrence. We've seen in states like New York and like other major states throughout the country that have enacted this, that these smoking rates will go down.
Okay. And so, David, you'll have plenty of opportunities over the course of this conversation, but at this point, do you have a minute either to respond to the points that Shannon just made, or if there's anything in her original argument that you think bears further discussion, by all means, go ahead.
Yeah, well, let me just respond to Shannon and say, if this was really about the kids and trying to encourage them to stop smoking, why does only 13% of the revenue generated by this tax go to tobacco cessation programs? And within that, why does only 2%, or about $20 million, specifically go towards encouraging kids to stop smoking? Let's understand where the money goes in this proposition, right? 82% goes to benefit insurers and hospitals who have put $20 million into this campaign. And an additional $10 million has been given by Tom Steyer, an individual, hedge fund manager, wealth manager individual who lives here in Los Angeles. And $10 million has been given by him. Now, people probably don't know who Tom Steyer is. He's running probably for governor in 2018 and didn't give any money to the tobacco campaign prior to this initiative. So I would argue he's in it for self-serving reasons too.
So David, let's come back to the funders in just a little bit, but I want to pick up on your first point because I think it's a particularly important one. I mean, Shannon, you make some pretty compelling points about the health risks and dangers associated with smoking, but David asks, if those risks are so pronounced, why is such a small percentage of money from the initiative proceeds going to anti-smoking programs?
So let's address this in 2 parts. The first is, I'm not going to let tobacco talk about what's best for our kids. Again, 14,000 kids are getting addicted every year. 1 in 6 Californians are dying from a result of tobacco. I'm going to actually side with the State Superintendent of Schools and Public Instruction, the PTA, the American Academy of Pediatrics, and many others who are looking out for our kids' best interest. The way that this initiative was designed is similar to other tax initiatives, tobacco tax initiatives. And so we know that a portion of the funding is going to go towards helping UCs with cancer research, crucially important. We know that a portion of the funding is going to go towards helping preventative measures to help people stop smoking, also very important. We know that A portion is going to go towards targeting smuggling of cigarettes and underage use, also important. And then the last piece is going to go towards Medi-Cal. So whether you like it or not, this isn't a debate about Medi-Cal today, but the reality is 1 in 3 Californians use Medi-Cal. That's the low-income insurance. And so what we're trying to do is right now, currently, Big Tobacco is targeting families and spending billions and billions of dollars to target families. They've spent over $70 million in this cycle. So what we're saying is, hey, we're not going to allow this. And right now, currently, as a result of cancer and all tobacco-related issues, each Californian family, because of Medi-Cal, is spending $413 per household. So we're just saying, hey, let's have tobacco users pay the user fee, and we want it to be a deterrence.
So if I can just break apart the answer real quick to make sure I understand what you're saying, is even if the percentage that David cited is the only portion of the funds going directly to anti-smoking programs, your argument is that the rest of the funds will help in that effort in other but related ways.
Correct.
Okay. So David, I'm going to ask you a question about a point you made in your opening statement. You expressed your concern, understandably, about the regressive nature of this tax and how, like any sales tax, more working class and middle class people will pay that than wealthy, and I understand your concern there. So I guess my question is this. If there were an initiative on the ballot, let's say you're successful in defeating this proposition, if there were an initiative on the ballot instead, either now or in 2 years, that would raise income taxes on the wealthy to pay for tobacco cessation programs and the other programs that Shannon has mentioned, would you be more willing to support that if the regressivity of the tax were eliminated?
Well, I mean, Dan, I think we're dealing in hypotheticals here, and I mean, I kind of want to focus on the proposition that's on the ballot and talk about that, and I would like to do that. And first of all, let me just say, Howard Jarvis Taxpayers Association doesn't represent big tobacco. I mean, were it up to me, there would be no smokers. I don't smoke, and everybody would stop smoking. That's just me personally. The issue here is regarding taxpayers and how the revenue is being spent, because there are fundamental problems with that. And again, Shannon's right. Some of the money does go to Medi-Cal, and that's not a bad program, especially when 33% of the state is on Medi-Cal. But the issue is, again, you're dealing with a declining revenue source. And the concern that I have with so much money going into the general fund for important programs like Medi-Cal, you do run the risk of California state legislators essentially rooting for people to smoke in order to ensure that the revenue continues to come into the state of California. And that's not appropriate, okay? What would be appropriate is more of this money, not just 13%, going to tobacco cessation programs, because that would instead encourage people to stop smoking, which I think everybody in this room, myself included, wants.
Okay, so we'll come back in a minute to the rooting for people to smoke framework, but what I want to do instead is offer a similar version of the same hypothetical that I gave to David to you, Shannon. It is a regressive tax, and you made an appropriate point earlier that smoking also tends to impact those from working class backgrounds and from those in poverty as well. But for all the laudable goals that you've talked about a moment ago, should those costs not be borne by the people of California overall as part of a general tax increase, as opposed to specifically targeted at this one subgroup?
No, this is a user fee. Right now, the state of California has I think it's the 40th lowest tax on cigarettes. In the state of New York, it costs over $15 a pack. We think that's appropriate. Here in California, we're talking about creating a $2 tax that would then have a pack of cigarettes cost about $8. If you want to smoke and you want to pay to smoke, then that's your decision. But I don't think that the people of California, the hardworking people of California, should have to bear the burden of the cost on our healthcare system.
Thank you, Shannon. David, I want to switch tacks just a little bit. One of the primary arguments that the No campaign has been making against this initiative is what a small percentage of this money goes for public education. And you guys have argued about the way budget money generally is allocated in California, and that this initiative does not give that money to K through 14, K through 12 education plus community colleges the way you think it should. once again, and I'll apologize in advance for the hypothetical, but I think, like a lot of voters, I want to get a sense for where you're coming from on this. Suppose, Shannon, we're able to, at this late date, reconfigure the spending and say, let's raise taxes on smokers to pay for both smoking cessation efforts, but also to give a larger amount of money. I think you're calling for 43% of the revenues to go through public education. Would you be willing to tax smokers at a higher level in order to fund public education?
No, Dan, because again, and I will address the issue broadly now, I don't think that's necessary. Listen, California just passed a record $122 billion budget in the state of California. Education funding has doubled, or not doubled, increased 50% since 2012 to $72 billion. We have $10 billion in our rainy day reserve fund right now as a state. So no, I mean, there doesn't need to be more general fund dollars to go fund education. And I mean, the fact is, again, if you think that's the case, Proposition 56 doesn't do that. Again, only $20 million goes to encourage tobacco cessation programs to keep kids from smoking. So if that is a laudable goal, regardless of how you think it should be funded, Prop 56 doesn't do that.
Thank you, David. Shannon, I'm going to take a point that David made earlier. He talked about rooting for people to smoke, and I'm going to put the question to you in a slightly different way. It seems to me that the initiative has two goals. Number one is to raise revenue for a series of very laudable programs. Then the other is to discourage smoking. If I understand David's point right, it says if you discourage smoking enough, there won't be sufficient revenue for these programs. Which of the two goals is the more important one?
The most important goal is to get people to stop smoking. So, right, again, I don't want to sound like a broken record, but the facts are the facts. I'm going to go with the American Academy of Pediatrics, the American Cancer Society, and all the other body parts, frankly, in supporting Proposition 56, because we know that the most important thing is to help protect and save people's lives. And right now, Big Tobacco is spending billions and billions of dollars to defeat this initiative, millions and millions of dollars to defeat this initiative here in California, billions of dollars statewide, or countrywide to get folks addicted, and we're not going to tolerate it.
Okay. All right, so we have time for just one more question, and I will put it first to Shannon and then to David. Yeah, I've had the privilege of being able to ask about the aspects of the initiative that I think are the most important. And so with your last 60 seconds, what is the last thing that you want our audience, both here at City Hall and our broader audience around California, to take away from your argument in favor of Proposition 56?
I'll close with where I began. Again, right now, Big Tobacco is spending a ton of money to deceive voters. We have 14,000 kids getting addicted every year. We would love to be able to have this measure pass so that we can ensure the safety of our youth and to ensure that, again, 1 in 6 people right now are dying from tobacco. That's not acceptable.
Thank you, Shannon. David, same question to you. What's the last thing that you want Californians to take away from the argument against this initiative?
Yeah, Dan, thank you. And I mean, I certainly don't want to sound like a broken record either, but again, if the issue is encouraging people to stop smoking, which is what Shannon said the point was, why does only 13% of the money go to tobacco cessation programs? Why doesn't it all go to tobacco cessation programs? But the fact is, again, it doesn't do that. 82% of the money goes to benefit wealthy special interests like insurers and hospitals. None of the money goes to the kids, or very little. And again, I do want to stress, you're dealing with a declining revenue source. Okay, second lowest smoking rate of any state in the nation is California, behind Utah. That number is going to continue to drop. The revenue's just not going to be there, and you're doubling the tax, and that is going to drive more things underground and more cigarette sales underground. So,
thank you, David. In just a moment, I'm going to ask you to join me in thanking Shannon Murphy and David Wolf for helping lead us through a very enlightening conversation on a critically important ballot initiative. Before I do, just a real quick moment for moderator's prerogative. For those of you who are watching today, either here at City Hall or around the state of California, I think regardless of where you come down on this or any of the other initiatives that we're talking about over the course of the day, the most important thing to do is to vote. Shannon may have convinced you. David may have convinced you. You may have changed your mind over the last 20 minutes. You may have not, and hopefully over the next several hours, you'll hear a lot of information that you may not have otherwise considered for and against a series of critical policy challenges that the state of California faces. But one of the questions I hear more and more frequently, and I know, Nate, you do as well, particularly from young people, is why should I vote? I'm just one person. There's 39 million people in California. There's hundreds of millions of people in this country. Why does my vote make a difference? And the question I generally ask them is I ask them if they recycle. And the answer is generally yes. Well, of course I do. And so the follow-up question logically is then, so separating paper from plastics, you are single-handedly saving our planet from environmental catastrophe and destruction, correct? And they say, well, of course not. But if everyone does their share, that helps accomplish a broader goal, I'd make the exact same point about voting. Let's thank Shannon Murphy. Let's thank David Wolf for a terrific conversation. Let's thank the team at C Political, the volunteers, the interns, the board members, and most of all, my friend Nate Kaplan for putting on today's program. Thank you all very, very much. And now we'll turn it back over to Nate, and we'll go on with today's conversation. Thanks very much for being here.